Hello everyone, and welcome to the Well Baby channel. Today's presentation is on IVF pregnancy, where we will delve into the fascinating world of assisted reproductive technology. In vitro fertilization, commonly known as IVF, has provided hope and a path to parenthood for countless individuals and couples struggling with infertility. Let's explore what an IVF pregnancy entails. Please be sure to watch until the very end, because I'm sure it will be very valuable to you new moms and anyone who would like to know more about the IVF process. Make sure to subscribe to the channel. This channel is all about your newborn experience and was created specifically to assist you as much as possible with your precious arrival. Now let's get straight into the video. IVF stands for in vitro fertilization, a medical procedure designed to assist individuals or couples who are having difficulty conceiving naturally. During this process, several steps are involved to create a pregnancy outside the body. In vitro fertilization, IVF, begins with ovulation induction. The woman is given fertility medications to stimulate the development of multiple eggs in her ovaries. These medications help ensure a higher chance of successful fertilization. When the eggs are mature, a minor surgical procedure called follicular aspiration, or egg retrieval, is performed. A thin needle is inserted through the vaginal wall and into the ovaries to collect the mature eggs. On the same day as egg retrieval, sperm from the male partner or a sperm donor is collected and prepared for fertilization. In some cases, sperm may be retrieved surgically from the male's testes or epididymis. The collected eggs and sperm are combined in a laboratory dish for fertilization to occur. This can be done through traditional insemination, where sperm are placed with the eggs, or intracytoplasmic sperm injection, ICSI, where a single sperm is directly injected into an egg. Fertilized eggs, embryos, are cultured and monitored in a controlled environment for several days. The goal is to allow them to develop into viable embryos. One or more healthy embryos are selected for transfer into the woman's uterus. This procedure is typically done 3 to 5 days after egg retrieval and fertilization. Hormone medications are often given to support the uterine lining and embryo implantation. About 10 to 14 days after the embryo transfer, a blood test is performed to check for pregnancy. If successful, the embryos will implant in the uterus, leading to pregnancy. IVF may require multiple cycles for success, and not all cycles result in pregnancy. The specific details of the procedure may vary depending on the individual's or couple's circumstances and the clinic's protocols. The journey begins with thorough medical evaluations of both partners. This includes hormone tests, ultrasound examinations, and assessments of reproductive health. The results help fertility specialists create a personalized treatment plan. In a woman's natural cycle, she usually produces 1 egg per month. In IVF, the goal is to stimulate the ovaries to produce multiple eggs. This is achieved using fertility medications that promote the development of several follicles, each containing an egg. Once the follicles are deemed mature, a minor surgical procedure is performed to retrieve the eggs. This procedure is guided by ultrasound imaging and is typically done under sedation. On the same day as the egg retrieval, a sperm sample is collected from the male partner or a sperm donor. The retrieved eggs and sperm are then combined in a laboratory dish for fertilization. In some cases, intracytoplasmic sperm injection, ICSI, might be used, where a single sperm is directly injected into an egg. Fertilized eggs, now referred to as embryos, are cultured in a controlled environment for a few days. During this time, embryologists monitor their development and select the healthiest embryos for transfer. A few days after fertilization, 1 or more embryos are carefully selected for transfer into the woman's uterus. This is a relatively simple and painless procedure, similar to a pap smear. The number of embryos transferred is a decision made collaboratively between the couple and their healthcare team, considering factors like age and embryo quality. Following the embryo transfer, there is a waiting period during which the woman is advised to take it easy and avoid strenuous activities. A pregnancy blood test is scheduled about 10 to 14 days after the transfer to determine if implantation and pregnancy have occurred. If the blood test indicates a positive pregnancy, the woman will undergo regular ultrasounds and medical checkups to monitor the pregnancy's progress. At this point, the process is similar to a natural pregnancy, with healthcare providers ensuring the well-being of both the mother and the developing fetus. In vitro fertilization offers a ray of hope for individuals and couples facing fertility challenges. The journey through IVF is one of perseverance, science, and the marvels of modern medicine. As we conclude our exploration of IVF pregnancy, we hope this information has shed light on the incredible steps involved in bringing the miracle of life to those who need it most. In vitro fertilization, or IVF, is a widely used assisted reproductive technology that has helped countless couples overcome infertility. One crucial aspect of the IVF process involves the administration of injections to stimulate the ovaries and aid in the production of eggs. We will delve into the safety of IVF injections, addressing the concerns and considerations surrounding their use. IVF injections are a vital component of the procedure. These injections contain hormones, such as follicle-stimulating hormone, FSH, and luteinizing hormone, LH, which help stimulate the ovaries to produce multiple eggs for retrieval. These hormones play a key role in the maturation of eggs and the regulation of the menstrual cycle. While IVF injections are generally considered safe and effective, they do come with potential risks and side effects. Common side effects include mild discomfort, swelling, and bruising at the injection site. Some individuals may also experience mood swings, headaches, or bloating due to the hormonal changes induced by the injections. One of the more serious risks associated with IVF injections is ovarian hyperstimulation syndrome, or OHSS. This condition occurs when the ovaries become swollen and painful due to an exaggerated response to the injected hormones. Severe cases of OHSS can lead to complications such as fluid buildup in the abdomen, blood clot formation, or kidney problems. However, advances in monitoring and adjusting the hormone dosage have significantly reduced the occurrence of severe OHSS. It's important to note that individuals may respond differently to IVF injections. Factors such as age, medical history, and underlying health conditions can influence how a person's body reacts to hormonal stimulation. Medical professionals closely monitor patients undergoing IVF to adjust the medication regimen and minimize the risk of adverse effects. Prior to undergoing IVF, patients are provided with comprehensive information about the potential risks and benefits of the procedure, including the use of injections. Informed consent is a crucial aspect of ensuring patient autonomy and understanding. Patients should openly discuss any concerns they have with their healthcare provider and make informed decisions based on their individual circumstances. If you're considering IVF, it's essential to consult with a qualified reproductive endocrinologist or fertility specialist. These experts will assess your medical history, perform necessary tests, and recommend a tailored treatment plan that includes the appropriate use of injections. Regular monitoring throughout the process helps ensure your safety and well-being. Be sure to tune into our other informative sessions listed right here on our channel. Like a week-by-week journey into your first, second, and third trimesters of pregnancy and healthy exercise and eating during pregnancy. You won't want to miss them. Let's explore the safety of IVF injections. In vitro fertilization, IVF, injections, which are typically used to stimulate egg production in the ovaries, can have potential risks and side effects. Here's a brief explanation of some of these risks and side effects. Ovarian hyperstimulation syndrome, OHSS. This is a potential complication where the ovaries become swollen and painful. Severe OHSS can lead to fluid accumulation in the abdomen and chest, as well as other symptoms such as nausea and shortness of breath. It is more common with high-dose ovarian stimulation. IVF increases the likelihood of multiple pregnancies, such as twins or triplets. Multiple pregnancies carry a higher risk of complications for both the mother and the babies. There is a slightly increased risk of ectopic pregnancy, where the embryo implants outside the uterus, with IVF. Rarely, the ovaries can twist around their blood supply due to the enlarged ovaries, leading to a medical emergency. Injections can cause bruising, redness, or pain at the injection site. Some women may experience abdominal discomfort or bloating during ovarian stimulation. Hormonal changes during IVF can lead to mood swings, irritability, and emotional sensitivity. Sometimes, ovarian cysts can develop as a result of ovarian stimulation. These cysts are typically benign and resolve on their own. In rare cases, individuals may be allergic to the medications used in IVF, leading to skin reactions or more severe allergic reactions. It's essential to discuss these potential risks and side effects with your healthcare provider before starting IVF treatment. The risks and side effects can vary depending on individual factors, the specific medications used, and the treatment protocol chosen by your medical team. Monitoring and communication with your healthcare provider throughout the IVF process are crucial to minimizing and managing any potential complications. In conclusion, IVF injections are generally safe when administered under the guidance of experienced medical professionals. While there are potential risks and side effects, advancements in medical technology and personalized treatment planning have improved the overall safety profile of IVF procedures. If you're considering IVF, engage in open communication with your healthcare provider to make informed decisions that align with your individual needs and goals. Thank you for watching our video today. Please like and subscribe if this information is helpful. Please leave any comments or questions below. Good luck on your parenting journey.